Hello, I am Felicity and I'm a clinical pharmacist at Ascot Vale Pharmacy. This presentation is going to talk about hypertension, so high blood pressure, what it is, what it means, and how can you treat it, prevent it, and manage it in an emergency. So this presentation, as I said, is going to talk about what high blood pressure really is. We're going to give you 3 tips about how to live with high blood pressure and manage those cardiovascular diseases or heart diseases that often accompany high blood pressure. And we're going to talk to you about how to be prepared for an emergency. So a bit of background about high blood pressure. And it's interesting to note that 32% of Australians, so about 4.6 million people, have high blood pressure. And these people are more likely to be men than women. And the risk of developing that high blood pressure increases with age. So the older we get, the more likely we are to experience higher than normal blood pressures. So cardiovascular disease is the leading cause of death and disability across the world, not just in Australia. And the leading risk factor or cause for that cardiovascular disease is high blood pressure. So it really highlights how important it is to manage high blood pressure effectively and get it down to a normal level. So by lowering blood pressure, it helps us to prevent strokes, heart failure, kidney disease, coronary artery disease, and even problems with your eyes as well. Hypertension is the medical term for persistent high blood pressure, and it is defined as when the force of blood moving around the body is consistently higher than normal. And we'll talk about what normal is in just a moment. So usually hypertension has no symptoms. You will not know if you have high blood pressure, unlike if you have an infection, your skin will go red and hot and swollen. When you have high blood pressure, you have no signs or symptoms. Even though you don't know you have high blood pressure, it does increase your risk of things like heart attacks, eye diseases, strokes, and kidney diseases as well. So like I said earlier, it's really important that we pick a target based on your condition and reduce to that target to minimize your risk. With blood pressure, when we measure it, there are 2 different readings. There's a systolic reading, which is usually the top number when you take your blood pressure. And this is the pressure around the body during a heart contraction. So when it's smaller and trying to pump around to the rest of the body, it's that pressure is called the systolic pressure. And diastolic pressure is the pressure when the heart is at rest, so when it's relaxed and filling up with blood before it pumps it out to the rest of the body. That is known as the diastolic pressure. So what is normal blood pressure? The ideal blood pressure for everybody is different depending on what stage of life they're at and what other conditions they have. Generally, we say that 110 to 130 millimeters of mercury as a systolic reading, so that top number, and 80 to 84 millimeters of mercury diastolic, which is the bottom number, are considered normal. But a normal reading that we aim for, as I said, is different depending on how healthy someone is and what other conditions they have. So it's really important to discuss your target blood pressure with your doctor and pharmacist so they can both help you to achieve the blood pressure that you're hoping for and reduce your risk of cardiovascular diseases. As we mentioned before, blood pressure is a silent disease. You usually won't have any symptoms of having high blood pressure. So how will you know if you even have it? The thing you must do is monitor your blood pressure regularly. So for someone who is under the age of 65, has normal blood pressure, no family history or other risk factors, which we'll go through in just a moment, will usually have to have their blood pressure monitored every 2 or so years. For people with a normal blood pressure reading, but do have a family history of high blood pressure or other risk factors for heart disease, they need to be monitored more frequently. And this is the same for people with high blood pressure already diagnosed by their doctor. This monitoring may happen every year, every 6 months. It really depends on how the blood pressure is responding to treatment and what other changes you have made to your lifestyle to reduce your blood pressure. So it's important to note that any change you make in your lifestyle, whether it be increasing activity or changing your diet, it will take 4 to 6 weeks for that change to show in your blood pressure reading. It doesn't happen straight away. So it's important to monitor your blood pressure at that every 4 to 6 weeks when you are implementing changes to make sure that you're getting the results that you're trying to achieve. Previously, I've mentioned things called other risk factors. Now, a risk factor is a condition or a situation that increases the chances of you developing heart disease. We categorize these risk factors into two groups: the modifiable risk factors, the ones you have the opportunity to change, and the non-modifiable risk factors, the things that are completely out of your control and you cannot change. So the modifiable risk factors include inactive lifestyle, being overweight or obese, having high cholesterol, smoking tobacco, and being under chronic stress. And the non-modifiable risk factors include a family history of heart disease, diabetes, age, so the older you get, the more likely it is that you'll develop heart disease, gender, men are more likely than women to develop heart disease, ethnicity, people of African or Asian descent are more likely to have heart disease, being poor, anywhere across the world, people who are poor are more likely to develop heart disease. And this is often associated with the chronic stress they're often under and the social isolation, which increases their risk. And things like anxiety and depression can also increase the risk of heart disease. And this again is associated with that chronic stress level. So this is a big list of different risk factors. So we can tell that blood pressure is just one piece of the puzzle that increases our risk of heart disease, and it's important to assess blood pressure in relation to all of these other risk factors and other situations that may also contribute to the risk of developing heart disease. Rather than looking at blood pressure alone, we look at all of these conditions to look at a whole picture of a person and manage that risk. So what are 3 things you can do right now to maintain a healthy blood pressure? The first is get active. Try to participate in at least 30 minutes of physical activity every day. Whether this is walking, swimming, bike riding, dancing, or anything else you enjoy that gets your body flowing and your heart pumping, it will help to lower your blood pressure and maintain it at a healthy level. Number 2 is to eat a balanced diet, which includes 5 serves of fresh vegetables per day and 2 serves of fresh fruit per day. Salt is often referred to as sodium on the back of a packet of food on the dietary label. So it's important to note that salt or sodium will increase your blood pressure when consumed above normal limits. So choose the low sodium option at the supermarket and don't add any salt to food while cooking or at the dinner table when you're sitting down to enjoy a meal. A balanced diet includes the avoidance of alcohol. It is known to increase the risk of cardiovascular disease and also your blood pressure. It contains a lot of sugars, which can affect your body weight as well. And it's important that we maintain that healthy body weight. So by doing step 1, which is get active, and step 2, eating a balanced diet, this will both work together to maintain that healthy body weight and minimize your risk of heart disease. And step 3 is to quit smoking. How to quit smoking is different for everybody. Some people do it cold turkey, some people get help from their doctor, some people get help from their pharmacist. But a good place to start is to pick a suitable stop date. Ideally, it's within 2 weeks of when you have decided that you're going to quit. Pick a date and prepare for that date. So you can prepare by reducing the amount of cigarettes you consume each day by cutting down a little bit per day until you stop at that 2-week mark. And practice quitting. So avoid smoking at regular times like breaks or when you're out for coffee. Try and practice not having a cigarette in those situations. And then comes the behavior change. So it's avoiding triggers like coffee, other people smoking, and modify the environment where there may be prompts like remove the ash tray from the car, and seek support from your friends and family or pharmacist and doctor. And try the 4 Ds, which are delay a cigarette, deep breathe instead of having a cigarette or when you're having those cravings, drink lots of water, and distract yourself when you're feeling like a cigarette. Go and do something else so it takes your mind off the idea that you want a cigarette. It's really a great idea to get support from your GP and your pharmacist, not necessarily to get medication to help you quit smoking, but to get that support for that behavior change, because it is a very difficult thing to do. And we understand that, and we want to help you to achieve the goal of quitting smoking so that you can modify your risk of high blood pressure and also cardiovascular disease. Now we know what high blood pressure is, we need to know when high blood pressure is an emergency. Most people with higher blood pressure will not have a hypertensive emergency. If you're interested about finding out how to reduce your blood pressure, the best people you can talk to are your local pharmacist or your local doctor or GP. They can give you advice on what you can do to reduce your blood pressure. However, if you have a high blood pressure of above 180 millimeters of mercury for the top number, systolic, or above 120 millimeters of mercury for the bottom number, diastolic, we consider this a hypertensive emergency. You need to see a doctor as soon as possible. You can see your local GP. If you can get in there as quickly as possible, you can go there and get help. If you can't get into your local GP, you need to go to a hospital and receive treatment as soon as possible. If you can't get to the hospital, you need to call an ambulance on 000 to get a doctor or help to you as soon as possible. So if you need your blood pressure checked, you can see a pharmacist, your local doctor, or a community nurse. If you have a severe headache and a very high blood pressure, you need to call an ambulance or get to a hospital as soon as possible. If you have chest pain, pain in your arm, shortness of breath, and lots of sweating, you need to call an ambulance and get to a hospital as soon as possible. These are symptoms of a heart attack and can be very serious if left untreated. Call an ambulance and get to hospital as soon as possible. If you're not sure what to do, you're not sure what's going on, call a 24-hour pharmacy and speak to a pharmacist. They know a lot about high blood pressure and the best way to manage it. You can call your local GP clinic if it's during the day or hours that they are open. And if it is an emergency, such as those we outlined before, call 000 and ask for an ambulance. 000 is for emergencies only. If you require advice at any hour of the day, you can call a pharmacist, but save 000 for an emergency. Often these kinds of emergencies happen after hours, so it's important that you know what services are available to you. To find local doctors, pharmacists, hospitals, and other emergency services close to you in the Northwest Melbourne area, you can visit the Health Direct website, type in your postcode, and find what services are close to you and what hours they are open. This can save you a lot of stress in a time of need. In summary, high blood pressure is when the force of blood moving around the body is